From reviewing widely used additives to packaging reforms, 2026 will be a critical year for the Trump administration to advance MAHA priorities as they face legal challenges and pushback from some food companies. Let's bring in FDA Deputy Commissioner for Human Foods, Kyle Diamantis. Kyle, it's so great, I think, to so many people that we finally have a president and a secretary of HHS who are bringing transparency in this space. So you say 2026 is going to be such a big year. We're going to take a look at some of the things that this administration wants to get done, dietary guidelines, defining ultra-processed foods, all of these different things. Tell us why 2026 is going to be so important.
Yeah, great to be with you, Laura. And look, 2026 will be a fundamental transformational year for the Trump administration, Secretary Kennedy, and FDA when it comes to food reform. There's a lot of big things we want to do. And look, we can't wait. This is an issue that has gone on for far too long in our country. When you talk about our national nutrition crisis, 70% of Americans are overweight or obese. We have over half of young adolescents who can't qualify for military service, and 15,000 new cases of diabetes each week. So we have deep problems in this country. We want to tackle those head on, and we finally have an administration in place that's willing to tackle these big problems. It's going to start with the dietary guidelines for Americans. Those will be coming out in early January, and those are a fundamental transformation of nutrition policy in the United States. They touch things like school reform, school lunches, WIC, SNAP reform, and a number of other federal programs. And really what Secretary Kennedy and this administration wants to do with the dietary guidelines is return to common sense. You know, this is a document that's ballooned to 400 to 500 pages in last iterations. It's a once every 5-year project. This version that will come out in the next 2 weeks will be small, it will be streamlined, it will empower parents, and it will return to a sense of eating whole foods. That's proteins, fruits, vegetables, dairy, and we're going to minimize and recommend minimization of these highly processed foods that are loaded with added sugar, that give us glycemic index rises, and that have, these processed carbs in them that really have ballooned since the early 80s and 90s. So this is a really big step in the right direction. It's just the tip of the iceberg for the work we want to do at FDA and HHS.
Well, I consider myself to be a MAHA mom. We all want to know that the food that we're giving, especially our children, and eating ourselves is going to make us healthier and not going to poison us, of course. What have you guys learned, though, from the administration in 2025 that you can apply to 2026? There have been some strides made already this past year, but it sounds like you guys have a lot more on the horizon. So what have you learned?
Yeah, we sure do. So, as soon as we came out of the gate in early 2025, we made a big push on petroleum-based dyes. You were part of some of those announcements that we had. And look, industry was receptive and responsive. And we realized that this is something we can tackle. We've got to do it incrementally. But the dyes, for example, there's no one silver bullet, Laura, that's going to solve our problems that we have in this country. But these incremental steps, like tackling dyes, do move the needle. And critics might say, when it comes to petroleum-based dyes, that these are not addressing the underlying chronic conditions like diabetes and obesity risk, but the reality is they are. We know that products that contain these petroleum-based dyes have on average 140% more sugar than products that don't use these dyes. And these dyes are used solely to attract and make foods more appealing to youth. They have no nutritional benefit at all. So it's just one small thing that we're looking to do. We're going to continue that effort as we get into 2026. We're going to continue to approve new natural alternative colors that industry can use. And that's really just the tip of the iceberg. We have sent a rule to OMB to change the GRAS standards in this country. And if you go back to the 1950s, Laura, what that means is that for decades now, companies have had the ability to self-determine that an ingredient is safe. They can make a determination that an ingredient is safe.
What could possibly go wrong with that, Kyle?
That's right. That's right. And there's no transparency in that. There's no knowledge at FDA.
Yeah.
So you always hear about these things where they say, well, look, Europe, they have 400 ingredients. In the U.S., they have thousands. The reality is we don't know.
We're getting there soon.
That's right. We don't know because we're not tracking these ingredients. So we're working to change those standards.
Well, Kyle, thanks for all the great work that you guys are doing. We're going to continue to follow this, and we appreciate you being with us this morning. Thank you so much.
Thanks, Laura. Good to see you as always.
I'm Steve Doocy.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.